Warning: your kidneys could be silently struggling right now, and you might not even know it. These two tiny, bean-shaped organs are responsible for filtering 50 gallons of blood every single day, removing toxins, balancing fluids, and keeping your body running smoothly. But here's the scary part: kidney damage often happens without any obvious symptoms, until it's too late. The good news? You can fight back. Today, we're revealing 15 powerful kidney recovery secrets that most people have never heard of but could make all the difference in protecting your kidneys and even helping them heal. So, if you want to avoid kidney problems, prevent dialysis, and boost your body's natural detox system, stick around. 1. Stay hydrated, but don't overdo it. Staying hydrated is crucial for kidney health as it aids in flushing out toxins and waste products, thereby supporting optimal kidney function. Adequate water intake ensures that the kidneys can efficiently filter blood, regulate electrolyte balance, and maintain overall homeostasis. However, it's essential to strike the right balance, as both dehydration and overhydration can adversely affect kidney health. The National Kidney Foundation emphasizes that healthy hydration means having the right amount of water in your body to maintain good health, cautioning against both dehydration and fluid overload. A study published in the Clinical Journal of the American Society of Nephrology investigated the effects of increased water intake on kidney function in patients with chronic kidney disease. In this randomized controlled trial, participants were assigned to either increase their water intake by 1 to 1.5 liters per day or maintain their usual intake over a 12-month period. The results showed that the group with increased water intake had a slower decline in kidney function, as measured by estimated glomerular filtration rate, compared to the control group. Specifically, the hydration group experienced a decline of 1.3 milliliters min 1.73 square meters per year, while the control group showed a decline of 2.5 milliliters min 1.73 square meters per year, indicating a 48% reduction in the rate of decline. However, overhydration can be detrimental. Excessive water consumption may lead to hyponatremia, a condition characterized by low sodium levels in the blood, which can cause swelling in the kidneys and impair their function. The National Kidney Foundation warns that too much water in the body, known as fluid overload, can be harmful. Therefore, it's essential to tailor water intake to individual needs, considering factors such as age, activity level, and overall health. Consulting with a healthcare provider can help determine the optimal hydration strategy for kidney health. 2. Follow a kidney-friendly diet. Embarking on a kidney-friendly diet is like giving your kidneys a spa day. They get the relief they deserve. By reducing sodium, phosphorus, and protein intake, such a diet minimizes the workload on these vital organs, allowing them to function more efficiently and recover from potential damage. A study published in the American Journal of Kidney Diseases in December 2023 delved into this topic. Researchers investigated the impact of plant-based diets on individuals with chronic kidney disease. Participants who adhered to a plant-based diet experienced a remarkable 41% reduction in the risk of chronic kidney disease progression compared to those on traditional diets. This study underscores the profound influence of dietary choices on kidney health. Incorporating antioxidant-rich foods, such as berries and leafy greens, into your diet can further support kidney health by combating oxidative stress. Additionally, managing blood pressure and blood sugar levels through dietary choices plays a crucial role in preserving kidney function. By embracing a kidney-friendly diet, you're not just nourishing your body, you're giving your kidneys the TLC they need to thrive. 3. Eat more antioxidant-rich foods like berries and cabbage. Incorporating antioxidant-rich foods, such as berries and cabbage, into one's diet can play a pivotal role in supporting kidney health and aiding in recovery. These foods are abundant in antioxidants, which combat oxidative stress, a condition characterized by an imbalance between free radicals and antioxidants in the body. Oxidative stress can lead to cellular damage in the kidneys, impairing their function. By neutralizing free radicals, antioxidants help protect kidney cells from damage and may slow the progression of kidney disease. A study published in the Journal of Renal Nutrition explored the impact of dietary antioxidant capacity on renal function. The cross-sectional study analyzed data from 9,777 individuals aged 35 to 65 years, assessing their diet using a food frequency questionnaire. The study found that higher dietary total antioxidant capacity was associated with better kidney function. Specifically, participants with the highest dietary total antioxidant capacity scores had a 23% lower risk of reduced kidney function compared to those with the lowest scores. Additionally, cabbage, a cruciferous vegetable, contains bioactive compounds that may help manage blood sugar levels and reduce the risk of kidney damage. A 2021 study noted that these compounds might assist in managing blood sugar and reducing the risk of kidney and liver damage, although further research in humans is needed to confirm these benefits. In summary, integrating antioxidant-rich foods like berries and cabbage into the diet can provide protective benefits for the kidneys by mitigating oxidative stress and supporting overall renal function. While more research is needed to fully understand the extent of these benefits, current evidence suggests a positive association between antioxidant intake and kidney health. 4. Avoid processed foods and artificial additives. Avoiding processed foods and artificial additives can significantly aid kidney recovery by reducing the intake of harmful substances that contribute to kidney damage. Processed foods often contain high levels of sodium, phosphates, and artificial additives, which can burden the kidneys and exacerbate existing conditions. A study published in the American Journal of Kidney Diseases investigated the association between ultra-processed food consumption and the risk of developing chronic kidney disease. The study followed over 14,000 adults without chronic kidney disease at baseline for a median of 24 years. The findings revealed that participants with the highest consumption of ultra-processed foods had a 24% higher risk of developing chronic kidney disease compared to those with the lowest consumption. Additionally, each additional serving of ultra-processed foods was associated with a 5% higher risk of incident chronic kidney disease. These results underscore the importance of limiting processed foods and artificial additives in the diet to support kidney health and recovery. 5. Control blood pressure and blood sugar levels. Maintaining optimal kidney health hinges significantly on controlling blood pressure and blood sugar levels. Elevated blood pressure exerts excessive force on the delicate blood vessels within the kidneys, impairing their ability to filter waste effectively. Similarly, high blood sugar levels can damage these vessels, leading to compromised kidney function. The kidneys play a pivotal role in regulating blood pressure through the renin-angiotensin-aldosterone system. When blood pressure drops, the kidneys release renin, triggering a cascade that constricts blood vessels and increases blood pressure. However, chronic hypertension can dysregulate this system, exacerbating kidney damage. Moreover, the kidneys contribute to glucose homeostasis by filtering and reabsorbing glucose. Hyperglycemia can overwhelm this mechanism, leading to further renal stress. A comprehensive study published in the American Journal of Kidney Diseases in 2009 explored the kidney's role in glucose regulation, highlighting that the organ is responsible for up to 20% of glucose production via gluconeogenesis. The study emphasized that maintaining blood sugar levels within the normal range is crucial for kidney health. Moreover, research has demonstrated that effective management of blood pressure and blood sugar can significantly reduce the progression of kidney disease. For instance, a study indicated that tight blood pressure control reduced the risk of kidney failure by 50%, while proper blood sugar management decreased the risk by 35%. In summary, diligent control of blood pressure and blood sugar levels is essential for kidney recovery and overall renal health. By mitigating the strain on these vital organs, individuals can enhance kidney function and reduce the risk of further complications. 6. Limit protein intake, especially red meat. Limiting protein intake, particularly from red meat, can significantly aid kidney recovery by reducing the metabolic burden on these vital organs. When we consume protein, our bodies break it down into nitrogenous wastes like urea, which the kidneys must filter out. High protein consumption, especially from animal sources, increases the production of these waste products, thereby overworking the kidneys and potentially accelerating the progression of kidney disease. This is particularly concerning with red meat, which not only elevates waste production but also introduces higher levels of saturated fats and cholesterol, contributing to inflammation and oxidative stress within the kidneys. A study conducted by Dr. Donald Wesson and colleagues at the Texas A&M Health Science Center College of Medicine, published in the Journal of the American Society of Nephrology, underscores this point. The researchers analyzed data from 1,486 adults with chronic kidney disease and found that those consuming diets high in animal protein were 3 times more likely to progress to kidney failure compared to individuals whose diets were rich in fruits and vegetables. Moreover, a study published in Scientific Reports highlighted a significant association between high consumption of red and processed meats and the odds of microalbuminuria, a condition indicating kidney damage. Specifically, the results of individuals with high red meat intake suggested that their risk for microalbuminuria was more than double the risk compared to those with lower red meat consumption. By moderating protein intake and opting for plant-based proteins or leaner meats like poultry and fish, individuals can alleviate undue stress on their kidneys, thereby supporting recovery and maintaining better overall renal health. 7. Use herbal kidney supporting teas. Herbal teas like dandelion and nettle have long been celebrated for their potential kidney supporting properties. Dandelion root tea acts as a natural diuretic, increasing urine production and aiding the kidneys in flushing out toxins and excess fluids. Additionally, its rich potassium content enhances kidney filtration efficiency and improves blood flow. Nettle leaf tea offers anti-inflammatory and antioxidant benefits, protecting kidney tissues from oxidative stress and inflammation. Its diuretic properties also promote waste removal and support overall kidney function. While these traditional uses are promising, it's important to note that scientific research on the efficacy of these herbal teas in kidney recovery is limited. The National Kidney Foundation advises caution, as some herbal supplements can affect kidney health and interact with medications. In summary, while dandelion and nettle teas have properties that may support kidney health, their use should be approached cautiously, especially for individuals with existing kidney conditions. Consulting a healthcare provider before incorporating these teas into your routine is advisable. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. 8. Reduce phosphoric acid intake found in sodas. Reducing phosphoric acid intake, commonly found in sodas, can significantly aid kidney recovery by mitigating potential harm associated with excessive phosphorus consumption. Phosphoric acid, a colorless and odorless crystalline liquid, is added to carbonated beverages to impart a tangy flavor and inhibit mold growth. However, its high phosphorus content poses risks to kidney health. When consumed in large quantities, phosphoric acid can lead to an elevated phosphorus load in the body. The kidneys are responsible for excreting excess phosphorus, and an overload can strain these organs, potentially leading to impaired function. This imbalance may result in hyperphosphatemia, a condition characterized by elevated phosphate levels in the blood, which is associated with an increased risk of chronic kidney disease. A study published in the American Journal of Kidney Diseases investigated the phosphorus content in popular beverages to inform dietary recommendations for individuals with kidney concerns. The research highlighted that certain sodas, especially dark colas, contain inorganic phosphates in high amounts, making soda consumption among patients with chronic kidney disease particularly concerning. Moreover, Excessive phosphorus intake has been linked to the progression of chronic kidney disease. The kidneys struggle to excrete excess phosphorus, leading to an accumulation that can result in bone disease and cardiovascular problems. So, reducing phosphoric acid intake by limiting soda consumption can alleviate undue stress on the kidneys, thereby supporting their recovery and overall health. Opting for beverages low in phosphorus and maintaining a balanced diet are prudent strategies for promoting renal well-being. 9. Maintain a healthy weight to reduce kidney strain. Maintaining a healthy weight is not just about fitting into your favorite jeans. It's also a crucial factor in reducing kidney strain and promoting renal recovery. Excess body weight, particularly obesity, imposes additional stress on the kidneys by increasing glomerular filtration rate, leading to hyperfiltration. This condition forces the kidneys to work overtime, potentially resulting in glomerular injury over time. Moreover, obesity is often accompanied by conditions like hypertension, insulin resistance, and chronic inflammation, all of which can further impair kidney function. A comprehensive meta-analysis published in the Nephrology Dialysis Transplantation Journal examined the effects of weight loss on renal function in obese patients with chronic kidney disease. The study encompassed 13 investigations where weight loss was achieved through bariatric surgery. Across these studies, a significant reduction in body mass index was observed. Notably, in 6 studies focusing on patients with hyperfiltration, glomerular filtration rate decreased post-surgery, indicating a normalization of kidney workload. Additionally, one study involving patients with chronic kidney disease, stages 3 to 4, reported an increase in glomerular filtration rate following weight loss, suggesting improved kidney function. Furthermore, reductions in albuminuria and proteinuria were noted in 6 and 5 studies, respectively, highlighting decreased kidney damage. The mechanisms behind these improvements are multifaceted. Weight loss alleviates hyperfiltration, reduces glomerular hypertension, and diminishes the progression of glomerulosclerosis. It also leads to better blood pressure control, improved insulin sensitivity, and a decrease in systemic inflammation, all beneficial for kidney health. In summary, achieving and maintaining a healthy weight can significantly reduce kidney strain and foster renal recovery. The evidence underscores the importance of weight management as a non-pharmacological strategy to enhance kidney health. So, while shedding those extra pounds might seem daunting, your kidneys will undoubtedly thank you for the effort. 10. Avoid NSAIDs and excessive painkillers. Nonsteroidal anti-inflammatory drugs, such as ibuprofen and naproxen, are commonly used to alleviate pain and inflammation. However, their impact on kidney health is a growing concern. Nonsteroidal anti-inflammatory drugs function by inhibiting cyclooxygenase COX enzymes, specifically COX-1 and COX-2, which are pivotal in the synthesis of prostaglandins. Prostaglandins play a crucial role in dilating blood vessels within the kidneys, thereby ensuring adequate blood flow and filtration. When nonsteroidal anti-inflammatory drugs suppress prostaglandin production, this vasodilatory effect diminishes, leading to constriction of renal blood vessels. Consequently, renal perfusion decreases, which can impair the kidney's ability to filter waste and maintain electrolyte balance. A comprehensive study published in the Clinical Journal of the American Society of Nephrology in 2019 delved into the association between NSAID use and acute kidney injury, AKI. This population-based study analyzed data from over 1.3 million individuals, comparing new nonsteroidal anti-inflammatory drugs users to non-users over a 30-day period. The findings were striking. Nonsteroidal anti-inflammatory drugs users exhibited a 58% higher risk of developing AKI compared to non-users. Specifically, 2% of NSAID users experienced AKI within 30 days, in contrast to 1.2% of non-users. This underscores the potential nephrotoxic effects of nonsteroidal anti-inflammatory drugs, especially when used indiscriminately. Avoiding or minimizing the use of nonsteroidal anti-inflammatory drugs can significantly aid in kidney recovery and reduce the risk of further damage. By steering clear of these medications, individuals allow their kidneys to maintain proper blood flow and filtration rates without the added stress of reduced prostaglandin levels. This proactive approach is particularly vital for those with existing kidney conditions or risk factors, such as hypertension and diabetes. 11. Get enough sleep for kidney repair. Getting enough sleep is like hitting the reset button for your kidneys, allowing them to repair and rejuvenate. During sleep, the body undergoes various restorative processes, including the regulation of renal blood flow, glomerular filtration, and electrolyte balance. Adequate sleep helps maintain the kidney's ability to filter waste and balance fluids effectively. Conversely, sleep disorders or insufficient sleep can disrupt these processes, leading to impaired kidney function over time. A study highlighted by the National Kidney Foundation, conducted by Dr. Saren McMullen of Brigham and Women's Hospital, explored the impact of sleep on kidney health. This research indicated that individuals with sleep disorders or reduced sleep quality had a higher risk of declining kidney function. The study emphasized the importance of good sleep hygiene in preserving kidney health. 12. Manage stress to lower cortisol impact on kidneys. Managing stress to lower cortisol levels plays a pivotal role in supporting kidney health and aiding recovery. Cortisol, often dubbed the stress hormone, is released by the adrenal glands in response to stress. While essential for various bodily functions, chronic elevation of cortisol can have detrimental effects on the kidneys. Elevated cortisol levels can lead to increased blood pressure and reduced renal blood flow, both of which strain kidney function. Over time, this strain can impair the kidney's ability to filter waste effectively, potentially accelerating the progression of kidney disease. Moreover, excessive cortisol can promote oxidative stress and inflammation, further compromising renal health. A study published in the Clinical Journal of the American Society of Nephrology investigated the relationship between psychological distress and kidney function decline. Conducted over a 5-year period, this study followed 3,000 individuals with chronic kidney disease, assessing their stress levels using standardized questionnaires. The findings reveal that participants with higher stress levels experienced a 10% faster decline in kidney function compared to those with lower stress levels. Specifically, the high-stress group had an average annual decline in glomerular filtration rate of 2.5 milliliters min/1.73 square meters, whereas the low-stress group exhibited a decline of 2.0 milliliters min/1.73 square meters. These results underscore the significant impact of stress on kidney health. Implementing stress management techniques can effectively lower cortisol levels, thereby supporting kidney recovery. Practices such as mindfulness meditation, deep breathing exercises, and yoga have been shown to reduce stress and cortisol production. Additionally, engaging in regular physical activity and ensuring adequate sleep are crucial components of stress reduction. By incorporating these strategies, individuals can mitigate the adverse effects of chronic stress on the kidneys, promoting better renal function and overall well-being. 13. Try intermittent fasting. Intermittent fasting has garnered attention not just for weight management, but also for its potential benefits on kidney health. By cycling between periods of eating and fasting, the body undergoes metabolic shifts that may alleviate stress on the kidneys. During fasting periods, the body shifts from glucose metabolism to fat metabolism, leading to reduced insulin levels and improved insulin sensitivity. This metabolic switch decreases the workload on the kidneys as they filter fewer byproducts of glucose metabolism. Additionally, it can reduce inflammation and oxidative stress, both of which are implicated in kidney damage. A study published in the Clinical Kidney Journal in 2017 examined the effects of fasting during Ramadan on kidney function. The study involved 31 patients with stages 3 to 5 chronic kidney disease who fasted during Ramadan. The results showed that creatinine clearance increased post-Ramadan compared with pre-Ramadan, suggesting that fasting did not adversely affect kidney function in these patients. While these findings are promising, it's essential to approach it with caution, especially for individuals with existing kidney conditions. Consulting with a healthcare provider before starting any fasting regimen is crucial to ensure safety and appropriateness. In conclusion, intermittent fasting may offer benefits for kidney health by reducing metabolic stress and improving insulin sensitivity. However, individual factors must be considered, and medical guidance is essential before making dietary changes. 14. Use natural diuretics like cucumber and watermelon. Incorporating natural diuretics like cucumber and watermelon into your diet can play a pivotal role in supporting kidney health and recovery. These hydrating foods not only quench your thirst, but also assist in flushing out toxins and excess fluids, thereby reducing the workload on your kidneys. Cucumbers are composed of approximately 96% water, making them one of the most hydrating vegetables available. This high water content promotes increased urine production, which aids in the elimination of waste products and prevents the formation of kidney stones. Additionally, cucumbers contain compounds like sulfur and silicon, which facilitate the removal of uric acid, a substance that, in excess, can lead to kidney damage. Watermelon boasts a water content of about 92%, making it an excellent natural diuretic. Its rich potassium content helps regulate fluid balance, encouraging the kidneys to expel excess sodium and water. This process not only reduces edema or swelling due to fluid retention, but also alleviates stress on the kidneys, promoting their recovery and optimal function. A comprehensive review published in the Systematic Reviews in Pharmacy explored the impact of watermelon consumption on kidney health. The study highlighted that watermelon contains a variety of compounds beneficial to the human body, aiding in the fight against various kidney-related issues. To harness the kidney-supporting benefits of cucumber and watermelon, consider adding them to your daily diet. Enjoy cucumber slices in salads or as a refreshing snack, and savor watermelon cubes during hot days or as a dessert. However, moderation is key. Excessive consumption of these fruits could lead to imbalances in electrolyte levels. Always consult with a healthcare professional before making significant dietary changes, especially if you have existing kidney conditions. In summary, embracing natural diuretics like cucumber and watermelon can be a delicious and effective strategy to support kidney health. Their high water content and beneficial compounds promote diuresis, aiding in the removal of toxins and reducing kidney strain. So, the next time you're looking for a hydrating snack, reach for these kidney-friendly options. 15. Get regular kidney function tests to track progress. Regular kidney function tests are essential for monitoring and promoting kidney recovery, acting as both diagnostic tools and progress trackers. These tests, including measurements of serum creatinine, blood urea nitrogen, and estimated glomerular filtration rate, provide insights into the kidney's ability to filter waste and maintain internal balance. By identifying early signs of dysfunction, they enable timely interventions that can halt or even reverse damage. A study published in JAMA Network Open in April 2020 examined the association between renal recovery after acute kidney injury and long-term outcomes. Researchers followed patients over a median of 42 months, categorizing them based on the duration of renal recovery post-acute kidney injury: 1 to 4 days, 5 to 7 days, 8 to 30 days, and no recovery within 30 days. The findings revealed that patients who recovered within 1 to 4 days had the lowest rates of kidney failure or a sustained 40% decrease in estimated glomerular filtration rate during the 90-day recovery period. Specifically, early recovery was associated with a 23% incidence of adverse outcomes, compared to 39% in those with delayed or no recovery. Regular monitoring through kidney function tests allows healthcare providers to detect subtle changes in kidney performance, facilitating early interventions. For instance, a declining estimated glomerular filtration rate may prompt adjustments in medication, dietary recommendations, or lifestyle modifications to support kidney health. Moreover, these tests can assess the impact of treatments, ensuring that therapeutic strategies are effective and minimizing potential nephrotoxic effects. In essence, routine kidney function testing serves as a proactive approach to kidney health, enabling early detection, timely intervention, and continuous evaluation of recovery strategies. By keeping a close eye on these vital parameters, individuals and healthcare providers can work together to promote kidney recovery and prevent progression to chronic kidney disease or failure. So, these were the top 15 kidney recovery secrets few people know. Now, we want to hear from you. Which of these surprised you the most? And which of them are you planning to include next in your routine? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.